Now, the most authoritative cardiac council in Germany just revealed that 3 sudden deaths were, in fact, likely due to the COVID vaccine. Dr. Peter McCullough, who's still banned from Twitter, I might add, has been investigating this phenomenon and joins us next with these troubling findings. Senator Ron Johnson hosted a forum yesterday titled COVID-19 Vaccines, What They Are, How They Work, and Possible Causes of Injuries. And it featured expert testimony of stories from victims of COVID vaccine injury, including many who've appeared on this show.
The spike protein, which the current mRNA vaccine products ask the body to make, are cardiotoxic. Let that sink in. The current public health plan is asking our own body to make a cardiotoxin.
The deaths on a more probable than not basis that are occurring in someone who've taken a vaccine are due to the vaccine, and the autopsy studies show it. It's alarming.
What Dr. McCullough just said is backed up by a frightening new finding. A report published in Clinical Research in Cardiology, the official journal of the German Cardiac Society, found that 3 people who died unexpectedly at home with no pre-existing disease shortly after COVID vaccination were likely killed by the vaccine. Joining me now is Dr. Peter McCullough, of course, epidemiologist and cardiologist, and author of Courage to Face COVID-19. Dr. McCullough, before we get to the details of this hearing, your response to the Twitter shadow banning news tonight, I know it comes as a big shock to you, given what they've done to you.
Medical censorship has to be stopped, Laura. This is a disturbing trend. You reviewed it well with Dr. Bhattacharya earlier today. Both he and I and others have been trying to bring America the truth on the pandemic with solid analyses, and we do have our right to free speech.
Well, and Dr. McCullough, you're one of the most, published cardiologists in the United States and the world, and a world-renowned expert on, cardiac conditions and cardiac arrests and causes and so forth. And if I keep saying this, if they can do it to you, I mean, they can do it to anybody. Mm-hmm. I mean, they did to the President of the United States, of course, for, various different reasons that were ridiculous. But in this case, they did it to you. You were a political person.
Doctors, and in my circle, we've become public figures as America's looked to doctors who can give an alternative analysis. There simply are data and multiple different interpretive points of view. America is tired of hearing a government narrative. They want to hear an intelligent conversation about what's happening in this evolving state of affairs with SARS-CoV-2.
And this German cardiology report where 3 deaths, sudden deaths, attributed likely to recent COVID vaccination. Do you think this is the tip of the iceberg?
I do. There's now autopsy reports from Verma, Choi, Gill, and this report from Schwab. It's clear that COVID-19 vaccine-induced myocarditis, about half the cases, there's no initial symptoms, Laura. The first manifestation is a sudden death found at home. In fact, the overall autopsy series showed 71% of all the patients found dead at home after vaccination within 20 days was actually due to the vaccine, either heart damage, blood clots, or other conditions attributable to the vaccine.
Dr. McCullough, that's not even to speak of the neurological issues, but we're going to continue to cover this with you and others. Thank you so much tonight.